while I bring up my screen and we start with this, requesting others as well that please put on your cameras, turn on your videos so that we can have an interactive session today with the expert speaker. So, Namaste, Sat Shri Akal, Salamu Alaikum, and a very fresh good evening, everyone. This is Sanghamitra, leading the K management team at Xyla Health, and I'm your host for the evening today. To start with, and for a quick introduction, Xyla Health is India's leading AI-powered health management platform that has served 5 lakh plus patients in 595 plus cities and happens to be the highest rated app with a 4.8 plus rating and delivers 24/7 care. We have been helping people with multiple health conditions such as COVID, diabetes, heart issues, kidney health issues, and women's health issues through a very able and experienced team that is in-house at Xyla for the highest quality care. So we all know that October is Healthy Lung Month, and it has been rightly said that we rarely think about breathing except when we have trouble doing so. We all have witnessed this during the COVID-19 pandemic. And we all have experienced that COVID-19 can have long-term effect on our lung function as well. Bringing back the proper lung functioning and capacity is the most important factor to focus upon. Along with this, we also need to be extra careful of the seasonal infections that are surrounding us. But what are the necessary actions that one should take to boost lung health? So to answer all these questions, we have with us Dr. Rajkumar here, who is a qualified pulmonologist with 22 plus years of experience in this field. He is trained and board certified intensivist as well. Dr. Raj has been associated with Fortis Hospital, Medeor Hospital, along with previous experience as head respiratory and critical care and ECMO specialist at Max Super Specialty Hospital. So with this, I welcome Dr. Raj to this webinar, to this platform. And we are very delighted to have you amongst us today on this platform, Dr. Raj. Looking forward to this insightful session with you. Before I hand it over to Dr. Raj, I am just requesting others that if you have any questions, you can start sharing those in the chat box section. आपके कोई भी सवाल हैं, आप chat section में share कर सकते हैं. Towards the end of the webinar today, we will be answering all your questions. So with this, over to you, Dr. Raj.
Thank you. Thank you very much. So I'll start sharing my screen first. Good evening, everyone. I hope all of you can hear me. Okay.
Yes, Dr. Raj, we can hear you properly.
You can hear me properly? Okay. So let me just start sharing my screen. I hope you guys can see the screen as well. Okay. As I would want. Yes. All right. Good evening, everyone. First of all, I would like to thank everyone, especially the Xyla and Sanghamitra, for giving me this opportunity. And I would like to welcome everyone who is there, and feel free to ask me any questions. I will try to keep the talk as simple as possible and would try not to use medical jargon, so that everybody understands what we are talking about. So first thing, COVID-19, I believe now everybody is aware what COVID-19 is, but for the sake of completing this presentation, I've still made the full form here, coronavirus disease 2019. And it is caused by a virus called SARS-CoV-2. The important thing here is to understand the variant of concern. And what is variant of concern? When COVID came in, we keep on listening, there's alpha wave, delta wave, Omicron coming, something different coming up. So what does that actually mean? That actually just simple means something very, very simple. The virus will keep on changing its phase. So actually the virus is mutating. When the virus mutates, there are a lot of mutations which are not as bad or not very harmful. So these are not variants of concern. The variant of concerns means which are more infective. So for example, Omicron was more infective compared to the Delta virus, but Delta was more severe in the disease compared to the Omicron virus. So this is how these two things are very important for understanding what are the variants of concern. And whenever a new variant comes into the picture, the WHO will update its website to tell us this is a variant of concern and you should be looking after your health. So this is the COVID-19 timeline. So basically all started in 2019, November and December, when Chinese reported some new virus. And initially it was called novel coronavirus. Then by January 2020, we all heard the first case which was reported in India. By March 2020, the WHO declared a pandemic of COVID. And from Indian point of view, the first wave came in 2020, and it officially peaked in around October. The next year, 2021, we had a second wave, and 2022 I left blank because now you can see third wave, fourth wave, people will keep talking about these waves all the time. So now it will essentially become an endemic disease. So that actually means that waves will keep coming every few months, but they will not be as bad as what we have seen previously. And the reason for that is our vaccination, and people already got exposed to the virus. So how does COVID affect my body? So that's an important question to know. And if you look at this picture, if the virus can actually impact almost every organ of the body, but the most important here is to look at the lung function. It can cause a lung distress and lung damage. So what it does, damage your alveoli and the capillaries. That's why a lot of people have a breathing issues related to this. You must have heard about a symptom that people could not smell or taste. That's because it damages, impacts your olfactory bulb, and that's where the problem occurs. A lot of people have issues of conjunctivitis, so tear in their eyes very frequently. Another thing which we all heard about is a formation of clot in the body, and that clot per se can cause a lung failure as well as a myocardial infarction. That means a heart attack as well. That's why most of the people were taking blood thinners at that point of time. It can also impact your kidney and as well as your liver. So essentially, COVID-19 can impact almost every organ of my body. So when somebody develops a COVID-19, what happens? How do they recover? So when you have an acute COVID-19, majority of the people will recover within the first few weeks, and most of them recover by 4 weeks. But there are a group of people, especially the elderly who are and others who are immunosuppressed or having chronic heart or lung disease. They can also have what we call as a post-COVID condition or a long form of COVID. By definition, if you have symptoms which are persisting for more than 2 months, that's what we call it as a long COVID. And that symptom should not be explained by any other ongoing condition of the patient. So this is what we do when somebody suffers from COVID and recovers. So we suggest them to take their medicines as suggested by the doctors, maintaining social distance, avoid unnecessary travels because you can spread the infection, or you can again, there's a possibility of you catching it again. Do a regular breathing exercises, do some yoga and physical for mental well-being. Some people do require some psychological counseling, have a high nutritious diet, and maintain a regular exercise pattern. The most important thing is also maintain a regular hygienic practices, including a sleep hygiene. So this is slightly a congested slide, but it gives a lot of important information, especially for the patients who have persistent symptoms. So if you look at this, the common physical symptoms are fatigue that occurs in 15 to 87% of the people. And in some of them, it can persist there for 3 months and longer. So a long, long time. Dyspnea, that actually means short of breath. So 10 to 71% of people have these symptoms, and it can persist again for a couple of months, 2 to 3 months. Chest discomfort. A lot of people come to us with non-specific chest discomfort symptoms. And this can be a post-COVID phenomena as well. Can persist again for a longer duration. Cough, another most common symptom, can persist for a longer duration. But if the cough remains more than 3 to 4 weeks, it can be due to COVID, but it could be because of another disease as well. So the government of India recommends to check for tuberculosis at the cough persist for more than 3 to 4 weeks. Anosmia means loss of smell. Most people will get back their smell within a month, but sometimes it can be longer as well. There are other common physical symptoms, people having a body ache, joint pain, headache, almost a lot of other symptoms as well, but usually they recover within few weeks. Mental disorders is also very common post-COVID, and that's happening because either they lost a dear one or sometimes lost a job or living alone for a longer duration. All of this is contributing to these psychological and neurocognitive symptoms, which include post-traumatic stress disorder, impaired memory, poor concentration, and anxiety and depression. Very common. And almost half of the people who had a bad COVID will tell you there is a reduction in quality of their life. So the important topic will be COVID-19 and lung health, and what can we do about that? So why are we talking about this? Because the lungs are the most commonly affected organ during the acute illness. They can have a long-term effect on the disease itself can have a long-term effect on our lung function. And it is very important to bring back the proper lung functioning and capacity. That's what we'll focus on today. So what are long-term effects of COVID-19? So COVID-19 can affect your lungs and can cause permanent lung damage. Severe COVID happens when there's a bad pneumonia and ARDS, means acute respiratory distress syndrome. That's the diagnosis, which it gives to the people who have bilateral pneumonia during the COVID. This can lead to scarring and lung fibrosis. And what are the symptoms? They are short of breath, discomfort, having some chest pain, persistent cough, and sometimes you can hear some wheezing or whistling sound from your chest as well. So how do I boost my lung health in post-COVID era? So these are the major things which we can do, and we'll discuss each of them in the next few slides. Smoking is dangerous, especially when you got a bad lungs to start with. Avoid exposure to smoke and pollution, which includes both indoor as well as outdoor pollution. Prevent lung infections. Take your regular vaccinations. Do regular exercises. And if nothing works and still you have an issue, then obviously speak to your doctor. So quit smoking. People who have a bad lung, especially after the COVID, if they continue to smoke, the smoke will make your lung function significantly worse, and your lung function will continue to deteriorate. The lungs, which are already compromised because of the COVID, if they get another toxic stimuli, the further damage will occur. So it's very important that you quit smoking. People who cannot quit should at least aim for reducing smoking. If there is a concern that you could not, then obviously get your doctor's help if you're unable to quit. And lung function test gives us significant important information, not only about the damage of the lung, but also how your lungs are impacted because of smoking. Second, we need to avoid the exposure to pollution. So the pollution can be indoor pollution as well as outdoor pollution. Smoking itself causes indoor pollution, a lot of dust which should be avoided. Even people using these agarbattis or burning anything at home, people parking their cars in their garages, all of them contribute to indoor pollution. Outdoor pollution, I believe we talk every time there's a winter, there's a significant talk about the outdoor pollution and what can be done to reduce it. The government is obviously working, but we all need to play our own part as well to reduce this. So the target, if you look at what should be the ideal air quality index, so WHO target is 0 to 10, which we have never seen in India. And now if you see 0 to 50 is good, 51 to 100 is satisfactory, 100 to 200 is moderate. We are almost always in poor, very poor, and very, very poor, basically. That's where we stand. Now, if the lungs are already impacted because of the COVID, exposure to pollution will further damage. Prevent lung infections. So any new infection will cause a rapid deterioration. So that's why somebody who had a severe COVID need to understand if they catch up another infection on the top of a compromised lung, their condition will deteriorate very fast. And prevention from common infections is vital. These are the most common flus, which are the most commonly impacted. So the viral infection that causes cells inside the nose throat to swell and you produce more mucus. The common flu which is around right now is a respiratory virus related flu, which is a common cold. Another H1N1 swine flu is also around the corner, and COVID-19 per se is another flu which is there. Common cold, each year it keeps on, we all get exposed to these viruses and we have the upper respiratory tract symptoms. So most of the time common cold is related to the upper respiratory tract, but people who are old, it can go to the and cause lower respiratory tract infections as well. That means it can impact your lung function. Bronchitis is an inflammation of the tubes of lungs, which are called bronchi, and people have this cough and produce some sputum. You need some antibiotics to take care of this. Pneumonia, as we all know, every year we see a lot of people who have pneumonia. So we need to prevent these pneumonias because it reduces your lung function further and can cause lung damage. Tuberculosis is a very common infection, especially in the Indian setting, especially when our immunity levels are low. Lung abscess is not very common. It usually happens on the people who drink a lot and keep aspirating things inside their lungs. But if your lungs are already impacted because of COVID, then we need to look after ourselves, that we need to reduce the alcohol and also prevent the aspiration. We just put 2 pillows so that it doesn't get aspirated. COVID-19, we again can get infected because of the COVID-19. Even if you had a COVID-19, you can again have a re-infection as well. Vaccination, this is one of the things which is most friendly for us, and that actually improves our long-term outcomes. So make sure that everybody gets a COVID vaccine and ensure a booster dose. Taking a COVID vaccine does not guarantee that you will not have a COVID again. But what it tells you that even if you have a COVID, it will not be of that severity. So right now, the people who are developing COVID, 98% of them are doing fine. It's only 1 to 2% of them will actually drop their oxygen levels down. So very important that, and as you will see in the coming years, it may just become a booster every yearly. That's what is going to happen. That's what is happening in the US, and that's going to happen in India as well as the time comes. Flu vaccine. Each year, you should be taking flu vaccine because if lungs are already impacted by COVID, they are already damaged. On the top of that, they may not be able to tolerate another bad infection. And it's easily available, preventable infection. Pneumococcal vaccine. Anybody above 65-year-old should be taking pneumococcal vaccine, or somebody who is below 65 but has any cardiac, respiratory, liver disease, they should be taking pneumococcal vaccine as well. So now these are the general tips to boost the lung health. So as we say here, do some steam inhalation 2 to 3 times a day. So how does steam inhalation help us? It's basically a natural mucolytic. So make your secretions thin so they can come out easily from your nose or from your lungs, and you can spit them out. So the chances of developing a secondary infection there reduces significantly. Maintain which is more important, so that secretions do not dry out. If the secretions do dry out, then there is a possibility. If secretions do dry out, then there's a possibility of developing secondary infection. Eating greens, leafy vegetables, and fruits in our daily routine that helps us to build our immunity, and that's why they are important. Walking. So do short walks in the morning and evening. But if you have a post-COVID condition, then do not push yourself. The reason for that is if we try to push ourselves, the heart is weak at that point of time as well. And we have a lot of experiences that people are developing a myocarditis or a heart failure. So the idea behind this one is gradually increase your exercises. So every week, try to increase the duration. And whenever you start it for the first time, make sure you check your oxygen level and your heart rate. So what we normally do is called as a 6-minute walk test, which we do in clinic, but this can be done at home as well. If you're still concerned, take advice from a physiotherapist or a yoga expert for your breathing exercises. The more breathing exercises you do, better your lung compliance will become. Most commonly used is spirometer, which the reason we recommend spirometer is whenever we are doing breathing exercise like pranayama, we do not know how much volume we are moving in. So if you have something to measure, like in spirometer, you have 3 balls, then you know exactly what's happening. If you are able to move 1 ball, when the lungs become slightly better, you will be able to move 2 balls and eventually the 3 balls. So that's important that we have something to monitor on. Sleep hygiene is very important in the post-COVID scenario because a lot of people who are not able to sleep properly, and also if you do not take adequate rest, the next morning you will feel very fatigued. And if you are already fatigued, anything you do, you will feel short of breath. So it's directly or indirectly related to your lung function and your quality of life. And still, if you have an issue, then obviously there's always an option of speaking to a doctor. So you can obviously find out what's happening, doctor. So what do doctors normally do, or a pulmonologist? They do a clinical examination. In this clinical examination, we want to know what makes you short of breath. And if you are having short of breath, whether the short of breath is on stress, or is it on exertion, or does it occur during the day, or does it occur during the night? So that gives us an idea exactly what's happening with your lungs. We also check the oxygen levels, and we also check the oxygen levels at rest. Then we make you walk for 6 minutes. That's called a 6-minute walk test, in which we want to know how much distance can you cover during that period of time, and how significantly there is a drop in oxygen level. And if you are trying to do it by yourself at home, if your oxygen level drops below 90%, do not push it. Or if your heart rate goes above 130, then do not just take some rest before you start or walking again. So that's very important, because if you try to push yourself, it may actually harm you rather than benefit. Lung function test. We recommend function test for most of our patients who had a severe or bad form of COVID. The reason for that is the lungs become stiffer. Lung capacities are already reduced. So we want to monitor how the lung capacities are behaving. In some people, as they do the routine of breathing exercises, take adequate diet, the lung capacities will gradually increase. Okay, but we do not know how much it will increase. It may not go to the baseline where the patient was before this COVID happened. But if it continues to improve, your lung function continue to improve, your quality of life is going to get better. And we suggest all our patients to, after COVID 1 month, we suggest them to do a lung function test, then at 3 months and 6 months. People who had a bad COVID or severe COVID, then we recommend some imaging as well, which can be in the form of X-ray or a CT scan. The idea behind this one is to find out if there is any scarring in your lungs. If there is any scarring in your lungs, then we know that your lung function will be limited, and we tell you the appropriate exercises so that things get better over time. And then the pulmonary rehabilitation. People who continue to feel short of breath or having respiratory distress, pulmonary rehabilitation is going to help them. And we normally tell them to do three things. One of them is obviously the breathing exercises. That's important. Second, we tell them to do some aerobic exercises, and we try to make a plan for them, see how every week gradually you will improve on this. And third is a muscle strengthening exercises, so in which your muscle strength will improve. As the muscle strength improves, you feel much better. And also during this breathing exercises, we tell them the technique of inspiration and expiration, which will keep your lungs open. So this is what the doctors do, and this is what we normally do in this post-COVID scenario. So thank you. I think that's all I have for my presentation. And I would be happy to answer any questions if somebody has.
Thank you so much, Dr. Raj, for making us understand about all those tips, all those techniques that we should focus, that we should always keep in our mind to make sure that we are focusing on our lung health as well. Would now request people, if you have any questions, you can unmute yourself and ask your questions directly. We do have one question in the chat box section, and then I have few more questions, Dr. Raj, that we have received from our users earlier. So we would be taking up those. So this question is from Mr. Ravi Shankar. The question is for asthmatics. Is steam inhalation useful? Like whether it will exacerbate because of strain of inhaling?
No, so steam inhalation is unlikely to help in a patient who has asthma. But with asthma, a lot of people have allergic rhinitis as well. So if you have allergic rhinitis, then there's a lot of mucus production from the nose, and you have a postnasal drip. In that scenario, steam inhalation may be useful. But what happens in the asthma? There is an airway narrowing, and there's an obstruction in the airway. The obstruction per se is causing the wheezing or a whistling sound. So it's unlikely that same temperature which we are inhaling here at our nose or mouth level will reach completely to your lungs and allow that inflammation to settle down. So very less likely. If people have these issues, there are tablets which are mucolytic, and the mucolytics we can obviously use it because it will liquefy your secretions and allow them to come out. The important thing remains in the asthma is the inhaled corticosteroids. So take your puffer properly and on time, especially during the change of weather, because the conditions will get worse when you're exposed to change of weather, any new allergen or any new infection. I hope that answers your question.
Thank you so much, Dr. Raj, for explaining that in detail. I think Mr. Ravi Shankar had shown that he is satisfied with the answer. So I think that has answered his question. Moving forward, the next question we have received from Mr. Rajpal. The question is, he is requesting to elaborate on the third vaccine. So as per the doctor, the third vaccine was pneumococcal vaccine that we were talking about.
Okay.
So
yep. All right. So the third, okay, so the vaccine we were talking, sorry, is it a COVID third vaccine or we are talking about pneumococcal? Okay, I will cover both of them so that in case somebody has a confusion, it will get away. Okay, let's talk about pneumococcal vaccine. So anybody, sorry, sir?
Yeah,
please say that again.
I was keen to know about the third vaccine, pneumococcal.
Pneumococcal vaccine, excellent. Okay, sir. So basically, the most common cause of community-acquired pneumonia is a pneumococcus. Okay, that's a bacteria. So if we take a vaccine for that, then the possibility of developing a severe pneumococcal infection is very, very less. So that's why there are two types of vaccines which are available. One we call as a conjugate vaccine, 13, PCV13. It comes with the name of Prevnar. It has to be taken once in your lifetime. So suppose somebody is 65-year-old, then we suggest them to take that one vaccine first. So if you take that vaccine, that's all. We are done and dusted with that. Then there's another vaccine called Pneumovax, which is a polysaccharide vaccine, contains PFV23, that's what we call it, comes with the name of Pneumovax. that has to be taken 1 year after you have taken the conjugate. And that vaccine has to be repeated every 5 years because the immunity levels comes down. So that's what we take for the pneumococcal vaccine.
Just to understand, I think this is very helpful because this is the first time I have come across this vaccine. You are saying that first you take the one vaccine which is for a lifetime, and after that you have to repeat the second vaccine every 5 years.
Okay, so let me rephrase that. So you can take any vaccine first, but that's a common trend because one vaccine is given once in a lifetime. So we give that as a first one. But that's called a PCV13 or Prevnar. It comes with the name of Prevnar in India. That's a conjugate vaccine. Okay, it only has to be taken once. The second, there has to be a gap between these two vaccines. So that's why after 1 year of taking the first vaccine, which was conjugate vaccine, we take after 1 year we take PSV 23. That's a polysaccharide vaccine 23. That has to be taken after 1 year and then has to be repeated every 5 years.
Okay, I got it now. Thank you.
Thank you, sir.
Thank you. That's very helpful, very useful information. Thank you.
Thank you. And it's actually life-saving. We recommend all our patients to take it. And because if you have somebody having a bad lung, especially after 65, we recommend for everyone. That's a clear-cut recommendation. So it should be taken. It can save lives.
Yeah, for the Xyla administrator, can you just please help share the names of the vaccine doctor has just indicated on the WhatsApp? That would be very helpful so that we don't mistake that. Thank you.
Thank you so much. Okay,
Sure, we'll organize that.
Moving on to the next question. This is from Mr. Yashpal. So Dr. Raj is asking that how do you differentiate whether it's flu or COVID?
Oh, okay. So, good question. The symptoms are very, very similar. All right. But sometimes the symptoms are very specific. Like if somebody lost their taste or smell, then obviously we know it's a COVID. Okay. But on a general terms, we do not try to differentiate that. The way to differentiate that, if somebody wants to do it, just do a RT-PCR because the similar symptoms will be very, very similar. And the RT-PCR test will be able to differentiate whether if a COVID comes positive, obviously it's a COVID. But if COVID does not come positive, then still there's a probability of COVID. But we know there are RT-PCRs for respiratory virus as well. But they are costly, and that's why we do not recommend too much to the patients. However, the patients who are sick in hospital, we do the respiratory panel, and that panel tells us exactly which one is causing the symptom. But from the community point of view, and if you're clinically stable, you do not have to differentiate it because there's no treatment for virus. Most of the treatment which we offer is a symptomatic care. So it's a very good saying regarding the virus. If you take medicine, it goes away within a week. If you do not take, it goes away in 7 days. That's how it works.
Thank you so much, Dr. Raj, for explaining that. I hope that answers your question, Mr. Yashpal. And now you would be able to understand since Dr. Raj has explained this in such detail. Moving on to the next one. This question is from Mr. Abdul. Sir, non-stop dry cough persists to my mother who had COVID and taken treatment. What to do?
Sorry, say that again.
Yes, so he's asking he's asking that non-stop dry cough persists for his mother who had COVID and taken treatment at that point of time. So what should be the next step?
So the cough, there are multiple reasons why somebody can have a cough. And the reasons not only start with the lungs, actually it can start from the top. Some people have what we call as a post-nasal drip. And the drip can be because of some infection, allergic rhinitis or sinusitis. Whenever some secretion touches your vocal cords, it will generate coughing. Others can have airway disease that can be related either to the COVID or even somebody having asthma or allergy per se can cause dry coughing. A lot of others have some cardiac issues can cause some coughing as well because the heart can cause congestion that can cause coughing, a lot of people. Other reasons is some people having gastroesophageal reflux disease that can again cause some coughing and allergy and sometimes the medication. So essentially to answer this one, patient has to be examined and then we can determine the cause for the dry coughing because most of the medication which we give without examining is the antitussive medication. That means it just reduces the cough. It does not treat the cough. Very to be examined if the cough is persisting. That's what I would suggest. Sometimes even that lung damage because of the COVID, any scarring that per se can cause dry cough for a longer period. I hope that answers your question, sir.
Moving on, the next question, I think this is a very nice question that we have got, Doctor. And definitely, I think all the people who have joined today would like to understand your view on the same, considering that you are here with us being the lung specialist. So, Doctor, this question is from Mr. Ravi Shankar again. He's asking that can we be happy the worst of COVID is behind us or can't say so now?
Good question, sir. Good question. So most likely the worst has gone. Now we should not have the waves which we had initially, and the reasons are multifactorial, sir. First thing, our body is already exposed to it, so it's very unlikely that we are not naive and the body will behave badly when we get exposed to it. Number one. Second, the vaccine, which is again helping us. Once we take the vaccine, the chances of developing a severe disease is very, very less. Third, the government is prepared. We have more beds, more hospitals, and the ICU setup. Fourth, the patient and in fact the whole community. Now, if somebody gets an infection, they know they would isolate themselves as soon as possible, and they get their testing done. So very less likely. Look, there are no guarantees in medicine. I hope that answers your question.
Great. Thank you so much, Dr. Raj. I think many people have now got that confidence since they have heard this from a doctor. So moving on to the next one. This question is again from Mr. Yashpal. So we talked about the COVID vaccine and the booster dose, doctor, in the presentation as well. So the question is, do you recommend that everyone in India get COVID booster, or is it only for aged or one with comorbidity?
Okay. So, sir, it all depends if we have something, how we want to use it. That's part of the judicious use of the resources. So right now, the vaccine on kids is being tested, but gradually, as you will see, the government, once they have a lot of vaccines available, they will allow the kids to have that as well. And the reason for that kids are not chosen as the first one is because most of them do not develop a severe disease. Most of the disease, even if they are exposed to COVID or any other virus, fortunately, they are not developing a severe form of disease, and that's the reason they are last on the list. But yes, over the time, you will see new and new vaccines will keep coming, including the ones which are available for kids as well. As you can see, government has already allowed up to a certain age. So the answer is yes.
So, Dr. Raj, one more question that many of our users, many of our patients have asked us that in your medical practice, what are the conditions that you have, or what are the situations that you have encountered after the specific COVID-19 pandemic period, with which the people are suffering?
So we have a lot of people who actually come having this chronic feeling of they can't breathe properly. They have a limitation in their activities. So we actually, this is a syndrome. It's not just one symptom which they have. There are a lot of symptoms, and especially the respiratory symptoms. What the issue with the respiratory symptom is, it increases your morbidity, it increases your suffering. So we have seen people who find it very difficult to even to wake up and even go to the toilet. So they are that short of breath. They have a lot of damage to their lungs and a scarring. Some people are on home oxygen for a longer duration and still on that. We also see people who are actually awaiting lung transplant. So there is a spectrum of disease which we have right now. But as I say, fortunately, we should not be seeing so many bad things again. So hopefully that will happen. But everybody is different. If somebody at a home infection from a virus, they may show very different symptoms. Someone can be almost asymptomatic. The other person may require oxygen. The third person may even require a ventilator. So people may have a different symptoms with this virus and whole spectrum. Some people coming to us with almost no similar symptoms at all, but we have seen the people who actually got worse of it. So hopefully, sir, this answers your question.
Absolutely, Dr. Raj. Thank you so much. And Dr. Raj, we have been receiving so many, thank you notes for you in the chat box section that the webinar is very informative and people.
It's my pleasure. Thank you, everyone. It's my pleasure. And obviously, I'm always available to see how can I help the community per se.
Absolutely. So, Dr. Raj is with us for any of your queries or one-to-one issues that you have been facing. We have kept this webinar on the occasion of Healthy Lung Month so that we can, through Dr. Raj, we can reach out to the masses to educate on better lung health after this COVID scenario specifically. But if in case you need any kind of support, any kind of one-to-one consultation, please feel free to reach out to us and we will definitely schedule your teleconsultation with Dr. Raj. And he would be definitely guiding you on the same.
Yes.
I
believe sir has another question coming up. Is that right?
Yes.
Okay. So the COVID symptoms keep lingering on once the virus is gone. Yes, that in some people that's right. Could it be severe later in the life too? Very unlikely. So, sir, it's just like a hit. So, as I say, how the body reacts to the virus, it all depends on that. So if the body responds, if you get hit by a virus, the body will respond in a way of inflammatory response. And that response is actually the one which causes a lot of damage to our body. Once the virus is gone, we are left with that response. Sometimes it takes some longer time for recovery, but the people who do recover are unlikely to deteriorate again because of the same issue. However, you need to understand your lungs now has a limited reserve. If you got a limited reserve and on the top of that, you got either a reinfection from the same virus or a different bacteria, then the possibility or the chances of deteriorating quickly is very high. So that's why it's important to prevent the secondary lung infections, take your vaccinations, improve your lung health, and that's what we were talking about.
Thank you so much, Dr. Raj. For the vaccine name, Mr. Ravindra, we will share the entire webinar's recording with you. Dr. Raj had mentioned about the vaccine.
So the name is Prevnar, sir. So Prevnar is the one which you only take once, okay? And another is Pneumovax, which you take one every 5 years. Pneumovax stands for Pneumovax, and Prevnar is Prevnar. I hope that answers.
Okay. Thank you so much, Dr. Raj, for helping here. Doctor, very oftenly we have common routine tests that are advised. Like for diabetes, we often ask patients to get their HbA1c test done in a span of 3 or 6 months. In terms of lung health, is there any specific routine test that one should take care of? Like there would be people who are continuously, are chain smokers or so.
Yeah.
Anything that
if someone is a smoker who comes to my clinic, I always recommend them to take a yearly lung function test if he is not quitting the cigarette. Even if he quits the cigarette, the lung function will continue to deteriorate for at least for the next 10 years. The deterioration will be much higher compared to the person who is not smoking. And after 10 years, the deterioration will be in a very, very similar way. So yes, if you do smoke, and actually what I find in my clinical practice, that when they come for a lung function test, and once they realize that lung function has already started reducing, it actually helps them a lot to quit the smoking. It actually becomes very useful for them to target the figure, and every few months they will come and say, we want to repeat the test. Although from our side, the recommendation is only once a year so that we know what's happening with your lungs and how fast the deterioration is happening. Once you stop it, the pace of deterioration will reduce, but it will not completely go away. As I say, it takes a couple of years, sometimes up to 10 years for the deterioration to reach the level of a non-smoker. So as we grow older, everybody's lung function deteriorates, but it deteriorates faster in the smoker. That's all I want to say.
Doctor, now that the COVID wave has started flattening and there are very few severe cases, we can say, although the people are again getting infected time and again, and this would continue, we understand that. But at this scenario as well, do you even now recommend wearing masks? Because when we go out in public, we see that people are still not wearing masks and they have become very casual about it. What's your?
I believe, look, when somebody has any viral infection, it's prudent to use the mask. Okay, and as a society, we all have a responsibility towards this one, because when we have some infection, we carry it out, we give it to our friends, our family members. So especially if you have a symptom, you should be wearing it. However, given that there is no severity now, the severity has reduced significantly. And that's why the government has also relaxed the mask requirement, because they now realize that people are not dying because of that. It's only behaving like a normal flu. And that's one of the reasons I believe you see the people are becoming more and more casual. But that's a human nature. As we get used to things, we don't care about it anymore. And that's what is happening here as well.
Absolutely. Doctor, on the same line, the festive period has started and we have seen rising levels of pollution in many areas of the country. Along with this season also encounters many seasonal infections that we also talked about in our presentation. Any specific advice there, doctor, that you would like to share with the audience that they should take care of?
So our audience who are above 65, then I tell them to obviously minimize going out or doing outdoor activities, especially in the winters. It's more common to get these viral infections. And if you want to do some exercises, we would suggest them to do at home. Use treadmill at home. If you can, then obviously use a air purifier as well. That's again one thing which they can do. And third, maintain your regular habits. And if you want to go outside for a walk, it should be going once the sun is out, so that all these particulate matters settle down. Otherwise, going early morning walk doesn't really help. It can actually make things and symptoms worse for you. So that's what I would suggest. Wear a mask. Wearing mask does not harm. It's going to benefit you. So wear a mask whenever you can. Do regular exercises. Maintain distances from the people. And if you're unwell or if anybody else is unwell, avoid them. Or you should avoid going to outside if you are unwell. So just a simple thing. And that will make a whole lot of difference. I hope this answers your question.
Yes. Thank you so much, Dr. Raj, for answering all those questions in such detail and for us as laymen to understand that. It's really enlightening, and as we have been started receiving the feedback as well. Thank you so much, Dr. Raj, for coming on this platform on the occasion of this Healthy Lung Month and making us understand about the tips and techniques for boosting our lung health. Just one last question that we have received, that in USA.
So, well, I think this will remain an endless debate of this RNA vaccine causing some lethal side effects or not. Okay, the reason for that is any medicine which we use will always have some side effects, and there will be a group of people who may have react to it very badly. So there will always be, any drug will have a side effect, including your vaccine as well. So some people may have side effects, but overall, if you look in the majority of the people, it will make life safer. We are again able to come out of our houses and continue to do our routine activities. if there was no vaccine, and then obviously the possibility of opening up would reduce. So I wouldn't really worry about there is a possibility, as you rightly said, there are group of people who will have a lethal side effect, and there are vaccines, but there are studies going on. So this is called as work in progress. So work in progress will continue. As we evolve, we will find which one was the best vaccine. We don't know, because as you know, initially our Indian vaccines were not even recognized by a lot of countries, just because they were not sure about their potency. So this is work in progress, and the discussion will continue forever. But don't worry, overall, you can see a lot of Indians haven't died because of the vaccine. They are helpful for us, and a lot of other countries are also actually asking for our vaccine. That's a good enough proof to say they work. Okay, I hope this answers that question. There's something else coming. Does wearing act as a deterrent for normal breathing? Okay, so depends on what sort of mask are you wearing. So every mask has multiple layers. The surgical mask is usually good enough right now when the infection is not very significant, or you don't know that if you are suffering from some severe infectious disease, you do not need to wear N95. The N95 mask was actually for the medical team. And what happens in India, you know, the community starts wearing it. But you just need a 3-ply mask, and 3-ply mask does not inhibit your normal breathing. N95 has a multiple more layers, and it does in fact, but you get used to it if you wear for some longer duration. That's what I would say.
Thank you so much, Dr. Raj.
Okay, I hope that answers your question. Thank you, sir.
Great. So with this, we come to an end to today's session, Doctor, and the audience. If there are still any unanswered questions, if there's anything that is still left, or later on you have any question, any queries, or you want to have a one-to-one consultation with Dr. Raj, you can surely reach out to us, and we will be happy to help you with all kind of health-related issues that you have. So with this, we end today's session. Thank you so much, Dr. Raj, once again for this informative and insightful session. Looking forward to more and more sessions with you to make sure that our audience is updated, is aware about the things that they should know about keeping their health in check. Thank you so much, everyone. Thank you so much. Please take care.
Thank you, everyone. And it was really a pleasure talking to everyone. Thank you, sir. Thank you, ma'am. Oh, thanks. Bye.